This is Dr. Rakesh Ranjan. One of the topics for today is going to be how to approach a loved one who has a mental condition or mental disorder and who is unwilling to receive any treatment. And this is a very common problem. I often have parents or relatives of somebody, let's say, who is in his or her late teens, and let's say has had first episode of mania or a first psychotic break, indicating possibility of schizophrenia, and the person is totally resistant to even seeing a psychiatrist. So this happens often. Now, here are some of the tips that the family members could use in convincing the person who has the mental condition about the need to seek treatment. First of all, the one thing to clearly convey to the person is that it's not their fault that they have these symptoms or difficulties. They did not choose to have these symptoms. The second issue to stress is that it's not a sign of weakness or a character flaw that they have these symptoms or difficulties. Because oftentimes people feel when it comes to psychiatric conditions that they should be able to, quote, control it, unquote. However, if somebody was just diagnosed with diabetes, for example, they would never say that. So where does that come from? That comes from stigma, and every stigma comes from ignorance. We have been so ignorant as a society collectively for so many years that it's a knee-jerk reaction that if I'm depressed, I should be able to overcome it myself. And also, if I go see a psychiatrist or a psychologist or a counselor, then people often feel that that's an admission that I'm a weak person. So that's where you need to start. Then the next point that's very critical is to convey to the person that the neurobiological conditions are medical conditions, like any other medical conditions, such as diabetes, for example. So to give the analogy that I often use, diabetes is due to chemical change in our pancreas, because our pancreas stops making enough insulin. Now, what causes that? Nobody knows that. Now, same is true for every neurobiological disorder in terms of there is a chemical change in the brain. And depending on type of chemical change and the location in the brain for that change, you have different symptoms which manifest themselves. So to convey to the person that the condition they are afflicted with is a medical condition, just like diabetes, for example, or multiple sclerosis, for example, and therefore it needs treatment. Now, oftentimes people will ask me, so what caused my bipolar disorder, for example? And I tell them that we do not know what causes these conditions, because that's the truth. Just like we do not know what causes diabetes, all we know that there's not enough insulin made by pancreas in people who have diabetes. But where is the starting point? We do not know that at this point in time, even though we've been familiar with diabetes and have been treating diabetes for many, many years. Now, this is a new frontier in medicine where we are diagnosing new conditions, the neurobiological conditions, and treating them. So I believe these are the main points that you could definitely try to convey to the person. And if you do that, many people will respond to these kinds of reasoned thinking, and in some cases, even with this kind of approach, you may have difficulty convincing the person. Thank you.